Communication in the field of physical therapy can occur in many different forms and tones. The patient is always the main focus of any type of communication, and it is critical that a physical therapist is able to communicate with not only their peers, but their patients, and in some cases, the family of the patients. Therapists must be able to communicate with a variety of people, including doctors, patients, athletic trainers, and patients' families. In order to further my research, I interviewed Dr. Chelsea Bartholomew, who retained her doctorate from Rocky Mountain State and currently works at Orthopedic Spine and Sport. She was able to provide me a great insight into the types of communication that occur in the physical therapy field. Dr. Bartholomew has worked in acute care situations prior to her job now, and she elaborated on the different communications that occur. You can't be afraid to go up to a nurse and tell them what's going on or ask for their help. If something's going on, you have to call the physician and keep in contact with them. The Journal of Acute Care Physical Therapy conducted case studies on patients in acute care physical therapy. Each physical therapist used the technique of SBAR, in which they analyzed the situation, background, made an assessment, and a recommendation. The initial meeting between the physical therapist and the patient and/or the family is critical to the relationship that is built between the physical therapist and the patient. There needs to be a certain level of trust and understanding between them in order to have a relationship that facilitates healing and progress. A typical form of communication that occurs between doctors and physical therapists is a typed up letter by the physical therapist, which includes all aspects of the patient's injury and recovery progress. A sample of this can be seen in the Athletico office visit. This letter includes descriptions of current treatment exercises along with future treatment plans. The physical therapist uses terms to describe exercises such as left passive knee flexion, SLR 3-way, and gastric strength 8-inch, all terms in which the doctor will understand. One way that doctors communicate back to physical therapists is providing them with a protocol for each patient's recovery. This can be seen in the example of post-op ACL rehabilitation and meniscal repair. This can be seen as the doctor provides the physical therapist with rehabilitation guidelines for a patient who has received knee surgery. All of the terms used have a mutual understanding between the doctor and the physical therapist. As physical therapists continue to work and expand their knowledge with each and every patient and doctor, they are able to develop new skills in order to enhance each patient's experience, because the patient is the most important part of the puzzle that physical therapists encounter every day.
Created using Powtoon.